Hello, this is Dr. Stanley Lang. Welcome to this broadcast, and the topic is, when can I eat dessert again? And the secondary question or topic is how to reverse diabetes. And the reason for the question came up with a patient that I've been seeing for about a year and a half who's been following my diabetes reversal program. I saw him shortly after he was diagnosed with diabetes a year and a half ago. And at that time, he was about 150 pounds overweight. At this point in his program, he has successfully lost 70 pounds in about 15 months. And he's doing very well with this strategy. He feels great. And a lot of the problems that he'd been dealing with, including tremendously swollen legs, a chronic infection in his legs, and of course the diabetes itself, have completely gone away. His blood pressure problem completely gone away. So he feels really good. And he's been very, very careful following the strategy that I teach in the How to Reverse Diabetes program, which is a very low glycemic eating strategy. And I basically have two variations. One is the ketogenic diet. The other is not ketogenic based, but very low glycemic. Both of them work to reverse diabetes. And this person has essentially reversed his diabetes. His A1C is all the way down to 5.1. For those of you who know what that means. His most recent fasting blood sugar is 85, and yet he's still 70 pounds overweight, and he's only 5'4". So you can see he's still in the category of morbidly obese. So this goes to show that if you just start moving in the right direction, doing the right things metabolically, you can reverse diabetes and experience that reversal well before you've reached your target weight. Now, he still plans to lose an additional 70 pounds. He'll probably do that over the next year and a half. But his question was, when can I start eating dessert again? Because he's looking, he was looking forward to he was expecting some challenges with the holiday season coming up. And he just wanted to know if he could have a piece of pie. And would that totally shoot him out of the water, or would he be okay? So we talked about the principles of how you start to introduce higher glycemic foods into the strategy that I teach without undermining this reversal process. And the basic rule of thumb is that we only know that you're totally reversed when you've lost all of your additional abdominal fat. Well, that's a long ways for him yet. That's a year and a half away, probably. But can he start eating high glycemic foods occasionally before then? And the answer is yes, but the problem is we don't know exactly how much he can and how frequently he can, because there's nothing to measure that's easy to measure. Now, if we could do some fancy blood work on him on a regular basis, where we're measuring insulin levels and a lot of other things that we don't normally measure in people, we could know which way he's going and whether having one pie every month was too much, or that he could have more than that. Now, as an aside, I told him he could just start eating ketogenic desserts and ketogenic breads and not have to worry about that at all. And he is actually quite willing to do that, but he's still socially, like many of you, is out with other people. And can he eat those sweets even if he's on this and faithfully following the program? Will it do him in or not? And at this point, generally speaking, when the A1C is down below 5.5 and the blood sugar is well within the normal range, like his 85 is, you can occasionally consume these foods without harming where you're at. Now, the proof is in the pudding. Everybody kind of knows whether they are undermining themselves by their own monitoring, their own blood sugar tests, etc. And the A1C obviously is going to show trend lines. And is he continuing to lose weight? That's the most significant marker. If you're following the low glycemic program with appropriate exercise, you will continue to lose weight until you're at your good weight, the weight that you're supposed to be at. And if all of a sudden that stops, you can be guaranteed that you're eating too much of the wrong foods. And I can't say exactly what that is because everybody's a little bit different, but the principles are there. If you stop losing weight when you have a lot more weight to lose, then that means that insulin resistance has increased from your diet, and that's telling your body to start storing fat again. So you have to drop insulin levels by eating foods that don't spike the insulin, and that's called low glycemic. And so So what I told him is basically, yeah, you could probably have a couple of pieces of pie during this Christmas season, and then maybe once a month, and then we'll check in 3 months and see what your A1C is doing. And that's the way that we're going to approach it in this case. Now, my advice to him was learn how to make ketogenic desserts and learn how to make ketogenic breads so that then you're not tempted to eat those kind of foods at other times. But if occasionally socially you're out there and you want to sample some of these other foods, or you don't want to offend your host, or whatever the reason might be, probably you can get by now that your A1C has twice been below 5.5 and his blood sugar's in the 85 range. Now, if his blood sugar was at 98, that's completely different from 85. If his A1C was 5.7, that's completely different from 5.1. I would have said, don't do it yet. So it is a bit of judgment, but this judgment is based on years of watching what happens to patients when they start going off the strict observation of the program and start to consume some things that are higher glycemic. Once your body's chemistry is completely fixed, you can occasionally eat high glycemic foods without pushing yourself back into diabetes. Not that I advise it, but that you can. The thing is that we know that you've completely reversed diabetes, as I said before, when the extra belly fat is gone. And so until you're at that point, you don't know that it's safe to consume these foods without doing lots of monitoring. So I hope this has been helpful to you if you're in this kind of a question. Is it safe to eat these desserts now, or will it force me into worsening diabetes and the direction that I don't want to go, which is more medicine, more complications, feeling worse, all that stuff. So I wish you well, God bless, and have a great day.